Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common behavioral disorders in children. In this chapter, you'll learn how to recognize the symptoms of ADHD and what criteria your doctor may use to diagnose it. The National Institute of Mental Health estimates that 2 million children in the United States have ADHD. But the disorder can be found in adults as well.
It's a disorder that starts in childhood and often continues. It can be diagnosed at any age, but the criteria specify that you have to have symptoms of ADHD as a child, actually before age 7.
So what is ADHD, and how is it diagnosed? Like most behavioral disorders, there is no objective medical test, such as blood analysis or a brain scan, that can be used to determine if a child has ADHD. Instead, a diagnosis is made based on a child's behavior and whether it matches any of the textbook symptoms of ADHD. There are 3 types of ADHD: hyperactive impulsive, inattentive, and combined. Children with hyperactive impulsive ADHD frequently fidget or squirm and can't play quietly. Those with inattentive ADHD are unable to pay attention to detail and have difficulty following instructions.
If you meet criteria for both, then you have what's called combined type, which would be the classical ADHD.
The majority of children diagnosed with ADHD have combined type symptoms. One of the greatest challenges in making a diagnosis of ADHD is that many of the symptoms are actually normal behavior for most children at one time or another. But for kids with ADHD, the symptoms are so excessive and long-term that they impair learning and stunt the development of social skills.
Everyone has inattention from time to time, so they have to have symptoms that are severe, more severe than the normal person in that situation.
If a parent has a concern, a question, if they think their child might be ADHD or have a learning disability, please seek professional help.
A variety of healthcare professionals are qualified to diagnose ADHD. First, a family doctor or pediatrician will examine the child to rule out any physical conditions that might be causing the symptoms.
So I'm going to take your blood pressure, you know, it doesn't hurt.
Next, the doctor or another healthcare professional will talk to the child's family and teachers to find out what symptoms the child has.
He was having a lot of problems on the bus, and he was having...
If those symptoms fall within the range of ADHD, the doctor then has to determine whether the behaviors meet the other requirements for diagnosis. First, the symptoms must have been present before the age of 7 and lasted for at least 6 months. And second, the symptoms must have significantly impaired the child's life in at least 2 separate settings.
The reason that we look for a problem in more than one area is because there is no medical test for ADHD. What you don't want to do is make a diagnosis of ADHD in a situation where there's just one particularly strict teacher, or a child maybe who's dyslexic, so has trouble in reading class but would be okay on the playground or somewhere else.
The final step in diagnosing ADHD is to eliminate other mental disorders, such as anxiety, schizophrenia, or a personality disorder, as the cause of the ADHD symptoms. Because ADHD commonly coexists with other conditions, such as learning disabilities and depression, it's important to examine a child for those as well.
Kids who have ADHD and learning disabilities, probably the same things cause both of them, only in slightly different parts of the brain. So it's not surprising you would see them together.
If you suspect your child may be suffering from ADHD, it's important to talk to your family doctor and begin seeking help. And remember, there is no reason to feel discouraged or hopeless. A child with ADHD, if diagnosed and treated properly, can go on to lead a productive and happy life.
They're resilient, they're creative, they're artistic, they're musical, they're bright, they're super intelligent, they're fantastic kids. And I tell my parents, please look for the gift in your child. Be positive about something each and every day.